Here we go, Treadle DPT back again, another anatomy breakdown, muscle by muscle. Today we're doing a deep dive into Psoas Major. We're bringing along little buddy as well, Psoas Minor. Psoas Minor is interesting because it's only present in about 40 to 60% of the population. Some people have it, some people don't, and we found that even if you do have it, maybe you only have it on one side. So, cool little tidbit. Unsung, overlooked, but at the same time very important core muscles. That psoas group is very important as hip flexors, posture players, and potentially the root of some of your low back and hip problems. So let's get to know these two muscles. We'll jump right in and see what we got. The Psoas Major originates from the transverse processes, bodies, and intervertebral discs of that T12 through L5 region on those vertebrae, running down the front of the pelvis to insert onto the lesser trochanter of the femur. It's a long, deep, spindle-shaped muscle that forms the iliopsoas complex along with the iliacus muscle. Psoas Minor, when it's present, originates from the T12 and L1 vertebral bodies, as well as the T12 and L1 intervertebral discs. It'll insert onto what's called the iliopectineal eminence, as well as the fascia over the iliacus muscle. Much smaller and much more tendinous compared to Psoas Major. So relatively straightforward for both of these. To reiterate our origins and insertions, we've got Psoas Major originating on the T12 through L5 vertebrae and their intervertebral disc. And then it'll travel down the pelvis, join with the iliacus muscle, and insert onto the femur's lesser trochanter. Psoas Minor, if you have one, will originate on the bodies of the T12 and L1 vertebrae and insert onto the iliopectineal eminence. Very, very simple innervation here. Both muscles are innervated by branches of the lumbar plexus, typically L1 to L3 for Psoas Major, and L1 alone for Psoas Minor. So Psoas Major is innervated by the anterior rami of nerves L1 to L3, and Psoas Minor is innervated by the anterior ramus of L1. The Psoas Major is best known as a primary hip flexor, but its role goes far beyond just lifting the leg. Functionally, it helps drive hip flexion, so of course think during walking, running, skipping, stair climbing. That psoas group is what's helping bring your knee up towards your chest. It also contributes to external rotation of the femur, and in certain positions can assist with lumbar spine stabilization. Because it connects the lumbar spine to the femur, it plays a unique role in lumbopelvic alignment and postural control, especially during standing and dynamic tasks. When it becomes shortened or overactive, it can pull the lumbar spine into increased lumbar lordosis, which is that additional roundness or arch in your lower back, and that contributes to anterior pelvic tilt, core imbalance, and compensatory movement up or down that chain. So functionally and clinically, it's more than a mover. It's a deep stabilizer that bridges that spine and lower extremity. If the psoas isn't functioning well, chances are your gait, posture, or core control aren't either. Clinically, the psoas major is a frequent contributor to anterior hip pain, lumbar discomfort, and poor posture. We spend so much time nowadays at desks or on the sofa, and unfortunately it's prone to be shortened in people who sit for long periods of the day or find themselves in those hip flexion postures. We mentioned that this can lead to increased lumbar lordosis, anterior pelvic tilt, and compensatory strains in that lumbar spine. We've also got some interesting newer research that suggests that psoas major is not just a hip flexor. It's maybe the key driver of ambulation and gait mechanics. A very recent study using a full-body bipedal robot found that disabling the psoas major alone completely disrupted gait, even when other major leg muscles were functionally normal. The psoas major was required for pelvic rotation, trunk lateral flexion, and to initiate that swing phase motion during walking. This emphasizes the importance of specific psoas major and hip flexion training, especially in our geriatric populations. From my own clinical experience, I can say that hip flexion component can be a very big area of weakness in our elderly population. But all of that reiterates what we've been saying. This muscle is much more than a mover. It's a stabilizer, a coordinator, and it's an essential piece of that puzzle when it comes to our upright function. So if you're not looking at psoas control in your rehab, performance, or postural programming, you're missing a major piece of the core system. When it comes to addressing psoas-related pathology, when it comes to working on those tight, shortened hip flexors, static stretching alone isn't sufficient. Stretching is usually our first thought, but not very proven and doesn't generally lead to pain relief on its own. But definitely important to activate and interact with that muscle. Resisted hip flexion exercises from various trunk positions are very beneficial. Muscle energy techniques are very, very beneficial. And it's also really important to use some neuro rehab type strategies, retraining that proper trunk control and hip extension during our functional movement patterns. All very important techniques for getting that psoas major back to its normal, healthy, resting state. So that's another one down. We're seeing now that psoas major is much, much more important than the layperson could ever realize. Because it's tucked so deep, it doesn't get near as much love as the abs or obliques, but uniquely important for core stability, important for upright posture, important for ambulation, and also a prime culprit in low back pain. If you're dealing with back pain, hip tightness, or poor lumbopelvic control, this is a muscle you definitely need to understand. So watch it as many times as you need. There's a lot of good tidbits in here for sure. As always, drop a like, leave a comment, hit that subscribe button, keep up with the anatomy breakdown series. Much more in store. Even more to come. Stay tuned, stay locked. Shadow DPT, catch you next time.